I'm Mulinda George. I come from Naisenyi village in Iganga district. I work as a community health worker. To be a community health worker, it means that I do all my roles in the village, in the community. I have to know their problems, and also they have to tell me their problems so that I can help them. As well, for me as a community health worker, I work as a chain between the community and the health facility. For me here in my community, I usually help people in very different ways. For example, a mother got delivered. She delivered in the hospital. They tied the cord. But as you saw, our road is not good. How they were coming back on the motorbike, they were just jumping up and down. As they reached home, the mommy continued just wrapping the baby. She never wanted the baby to get caught. So she went on weeping, just rolling with all the clothes. When I looked at the baby, the color of the baby was not good. I said, what is happening? So I started to handle that, the baby. Finding the baby was bleeding through the cord, was bleeding. All the clothes were full of blood. So there I had the gloves. I put on the gloves. I tied the cord properly. So again, I sent them back to the hospital for treatment. So up to now, whenever they see me, they say, "Your boy, your boy, your boy, your boy." The woman is telling them that is the one who saved the life of my child. If they have some problems, like illness, they have to come and inquire from me. Not only that, they can be suffering from, let me say, malaria. But you have to tell them that if you want to get rid of malaria, get away the bushes, stagnant water, so that the mosquito cannot lay eggs around you. Sometimes people in the community, they can get, let me say, like malnutrition. Malnutrition is a big problem. Yet for me on my side, I think we can fight about it if we join. Because I be sharing with my fellow victims to see the conditions in the country. I can also ask those people, how are they doing their work? Well, even how are the communities get income? How are they doing to help the younger children? Because like here me, I help mothers right from pregnancy. I go there to tell the mother to take the children for immunization. I have to teach the mother the danger signs during pregnancy, then danger signs after delivery, then danger signs of the child. Have to train the mother. And I don't only train the mother only, but I train the family. If I get a chance and I get the husband, the mother-in-law, I bring them together and I teach them. For a man like me, I've become well known to almost everywhere in my area, even the health facilities. If I go there, they say, "Oh, our member, our health worker also." They call me health worker whenever I go there because of being a volunteer. Had I not be a volunteer, I think I would not be here now. But because of that, so I needed that. Yeah? I've got so many friends through being a volunteer, so I love it. They call me everywhere. Even you can find a husband, say, "You come to a friend." Come to a friend. You know, in Africa here, it is very difficult to identify a pregnancy mother during early stages. They usually hide. But for me now, I've got a chance. They know me that I teach them what they want. By the way, we ourselves, we are the health centers, one. So we treat mostly by words and referring. But we are health centers, one. Uganda, for me, I say it is a very good country, very fertile, but we lack the techniques. If it's possible for victims, they need some more training, because the training they have others, it's not enough for them. And also to go and visit other victims from different parts and how they do their work, also share with them. Yeah, I think that can help us so much.